Hi, this is Erin from Educated Nurse, and I am going to start a new lecture series today on what it was like to be an ER nurse turned breast cancer patient survivor and what it was like to go back to normal life. There's going to be 11 different lectures with this topic, and the first one is going to be on cancer diagnosis. I do want to put a disclaimer out there that this video is for instructional purposes only. The information shared is my story, and it's not everybody's story. None of the information shared should be considered expert medical advice. The information presented should not replace the information provided by your doctor. Please work with your own doctor to find the best course of treatment for you for your situation. Also, I will use medical terminology which may not be suitable for children. And please also be aware that I'm very honest. I tell it how it is. I don't sugarcoat, and for that I apologize for the occasional profanity. In January of 2016, I went to my OBGYN's office because I felt a painful lump in my left breast. I had noticed it for a couple of weeks, and to be honest, I felt lumps and bumps in my breast for years. At this point in my life, I was a brand new baby ER nurse. I had just started working in the ER at kind of my dream job location, and within 1 week of me starting there, I got my diagnosis. I remember asking one of the docs what it was like to have breast cancer or what it would feel like. And I remember they showed me this fake rubber boob with varying sizes of breast cancer lumps. And I remember thinking to myself, breast cancer was supposed to feel like a hard pea fixed to the floor of my boob. So I just kept that in the idea in my head that as long as it doesn't hurt and it doesn't move, it's okay. At first, when I was going through this, I thought I had pulled a muscle or I had a knot or something. I had recently started boxing again after my recent gallbladder removal surgery, so to be honest, I let it kind of go by the wayside. Then I got my period, and being a good little nurse that I was, I knew it wasn't a good time to assess the lump a week before or during after your period, as it can give you a false sense of lumpiness and tenderness, so I let it be. A week later, I noticed it was still there, it was still painful, so I saw the OBGYN. Going into the appointment, I wasn't too worried, and neither was she, as I was always told, hey, you have lumpy, bumpy boobs and a history of benign cyst. During the appointment, the doctor confirmed the lump but wasn't too concerned, for a variety of reasons. I didn't have very many risk factors. At the time, I was 33 years old. I had no history of breast or ovarian cancer in my family. I had my kids at a young age. I was under 35. I breastfed both my kids. I didn't take hormone replacement. I had a history of bumpy, fatty breasts. I didn't have any discharge from my nipples at all. I wasn't greater than 60 years old. I didn't drink alcohol. And the lump moved and it was painful. Now, for good medicine, we decided it was the right thing to do and work it up, so my doctor scheduled a mammogram and an ultrasound just to make sure it wasn't anything more. The following week, I got to the breast cancer center at 10 a.m. for my mammogram. I was told the machine was going to squish and slam your boobs in between these plates and it was going to hurt like hell. So I got undressed and sat in this lovely, calm room with lavender aromatherapy being misted into the air. The mammography tech was absolutely wonderful. She calmed my nerves and explained what was going to happen. And after the first squish, I realized it wasn't going to be so bad. There was no indication that my boobs were going to be ripped from my body during the exam. After the mammogram, I went back into the little calming room with misting lavender and waited for the ultrasound. The ultrasound tech was also a wonderful human being. She explained everything that she was doing and showed me where the lump was and what it looked like. During the ultrasound, though, I did notice that she started ultrasounding my armpit, and I asked if she was looking at my lymph nodes. The nurse and me kind of figured out what was going on. I remember wondering if something was wrong, but she told me it's standard to look in the armpit because many breast cancers originate in that area. When she was done, she had me wait in the room for the radiologist to come in and talk to me about my results. I was a little nervous at this point, I'm not gonna lie. When the radiologist came in, she also ultrasounded my breast and armpit area. She was taking all kinds of measurements and I got suspicious, but I waited to ask questions. At the end of the ultrasound, the radiologist explained that I had not one, but 3 areas of suspicion. I had that large lump that I could feel, which is about 1.5 by 1.5 centimeters, and then there were 2 smaller lumps in the same area. I could not feel the smaller lumps as they were up against my chest wall. She told me, because of the suspicion of breast cancer, a biopsy should be done that day. There it was, the C word. I was in shock. I was devastated. Literally, the wind was knocked out of me. I immediately thought it was a death sentence. The world stopped turning, at least I felt like it did. Cancer? Really? I was 33 years old. It couldn't be. I remember walking out of the hospital and crying hysterically. I couldn't breathe. I couldn't catch my breath. I felt like vomiting. I called my mom and she met me at the hospital. I remember I just cried and shook and I couldn't wrap my head around it. My mind kept spinning and thoughts about my family and life kept swirling around in my head. Later that afternoon, we went back to the hospital for the biopsy. It wasn't bad. The site was numbed with lidocaine and the radiologist took 4 samples of tissue. When she was done, she placed a marker, or what I affectionately called the human tracking device, in the lump for accurate identification and site marking, if it came to that point. Before leaving, the radiologist explained that this was probably cancer and I should prepare myself for a long journey. She told me, think of 2016 as a book, and this was page 2 in my cancer journey. That night, we left for a medical conference, hoping to keep my mind busy and off the idea of cancer. The 3-hour car ride was exactly what I needed. It was filled with emotions, disbelief, doubt, anxiety, and terror. Luckily, my chief of comic relief, aka my brother, was on hand to blast various 1980s and 1990s movie soundtracks to sing along to. Top Gun proved to be just exactly what I needed to keep me from not losing my shit. Now, let me just say, I hate waiting. I'm a planner and I hate waiting. I was constantly checking my phone the next day during the conference, hoping someone would call with my pathology results. I just remember waiting and waiting and waiting and waiting. At 4:30, I got the call. The lovely nurse told me the bad news. You have cancer. I was told I have stage 2, grade 2 invasive ductal carcinoma. It was heart-wrenching. Everything I was told and everything I learned in nursing school about the characteristic of breast cancer were not true, not for me. So why did I get breast cancer? I tried to take notes and not cry at the same time, but I wasn't super successful. From that moment on, the wheels of treatment and information gathering were put into motion. Now, I will say, before I kind of dive into some treatment things here, it's super important to take a moment for yourself to breathe before all this chaos begins. Take some time to be with your family, take some time to go get a massage, take some time to just let all the information sink in and process, because once treatment starts, things move so quickly and then you just get into survival mode. So take a minute for yourself, let things process, and really kind of just organize your thoughts and make a list of questions, figure out what doctors you want to see, make sure you're getting all the information so you are prepared to navigate your breast cancer diagnosis. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.